HIV/AIDS in Black people in the USA. Introduction. HIV/AIDS continues to be a significant public health issue in the United States, disproportionately affecting the Black community. Despite advancements in prevention, treatment, and education, systemic inequities in healthcare access, socioeconomic disparities, stigma, and cultural barriers contribute to higher HIV/AIDS rates among Black individuals. Understanding these factors is critical to addressing the epidemic and ensuring health equity. Disproportionate impact on Black Americans. Black Americans make up approximately 13% of the U.S. population, but account for nearly 42% of all new HIV diagnoses. This stark disparity stems from a combination of social, economic, and cultural factors. 1. Prevalence in communities. The high prevalence of HIV in predominantly Black communities increases the likelihood of exposure. When HIV is more common in a community, even low-risk behaviors can lead to higher rates of transmission. 2. Socioeconomic disparities. Poverty, unemployment, and lack of stable housing, which disproportionately affect Black Americans, limit access to healthcare and HIV prevention tools like condoms and pre-exposure prophylaxis, PrEP. 3. Healthcare access. Structural inequities in healthcare access mean fewer Black Americans receive timely testing, treatment, and care. This delay can lead to higher viral loads, increased transmission, and worse health outcomes. 4. Stigma and mistrust. Cultural stigma around HIV and a legacy of mistrust in gendered impact of HIV/AIDS. The epidemic impacts Black men and women differently, with unique challenges for each group. 1. Black men. Men who have sex with men. MSM. Black MSM face the highest rates of HIV diagnoses in the country. Factors include limited access to culturally competent healthcare, stigma surrounding homosexuality, and systemic barriers. Heterosexual men. Heterosexual transmission also contributes to new cases among Black men, often due to overlapping risk factors such as incarceration and limited healthcare access. 2. Black women. Heterosexual transmission. Black women represent the majority of new HIV cases among women, largely through heterosexual transmission. Socioeconomic vulnerability, intimate partner violence, and limited access to healthcare amplify risks. Mother-to-child transmission. Although significant progress has been made in reducing perinatal transmission, disparities persist due to limited prenatal care in some communities. Barriers to prevention and treatment. Several systemic and individual-level barriers hinder efforts to prevent and treat HIV in Black communities. 1. Testing and diagnosis. Many Black Americans are diagnosed late in the progression of HIV, reducing the effectiveness of treatment. This delay is often due to fear, stigma, or lack of access to routine healthcare. 2. Treatment adherence. Once diagnosed, Black individuals face challenges in adhering to antiretroviral therapy, ART. These include financial barriers, unstable housing, and mistrust of healthcare providers. 3. Education and awareness. Misinformation and lack of targeted educational campaigns in Black communities contribute to misunderstandings about HIV transmission and prevention. 4. Cultural competency in healthcare. Many healthcare providers lack training in addressing the unique needs of Black patients, leading to mistrust and inadequate care. Intersection of HIV and social determinants of health. The epidemic in Black communities is deeply intertwined with social determinants of health, including 1. Incarceration. Mass incarceration disproportionately affects Black Americans, contributing to higher HIV rates. Prisons often lack adequate prevention and treatment services, and the challenges continue upon release. 2. Education and employment. Limited educational opportunities and high unemployment rates exacerbate vulnerabilities, making it harder for individuals to access prevention tools and healthcare services. 3. Geographic disparities. HIV disproportionately impacts Black communities in the southern U.S., where healthcare infrastructure is weaker and stigma around HIV is more pronounced. Strategies for addressing disparities. To reduce the burden of HIV/AIDS among Black Americans, a multifaceted approach is essential. 1. Expanding access to prevention tools, PrEP and PEP. Scaling up the availability of pre- and post-exposure prophylaxis can significantly reduce new infections. Condom distribution. Increasing access to free or low-cost condoms in Black communities can help lower transmission rates. 2. Enhancing education and awareness. Culturally relevant campaigns. Targeted educational initiatives addressing stigma, prevention, and treatment are critical. School-based programs. Comprehensive sex education can empower young people with knowledge about HIV prevention. 3. Improving healthcare access. Medicaid expansion. Expanding Medicaid in states with high HIV burdens could increase access to care. Community health centers. Strengthening. These centers can provide trusted care in underserved areas. 4. Reducing stigma. Community engagement. Partnering with churches, community leaders, and organizations can foster open discussions about HIV. Mental health services. Addressing the psychological impact of stigma can help individuals seek care. 5. Addressing structural inequities. Criminal justice reform. Reducing incarceration rates and improving health services in prisons can mitigate the epidemic. Economic empowerment, job training, and educational initiatives can address the root causes of health disparities. Success stories and progress. Despite challenges, there have been notable successes in addressing HIV in Black communities. 1. Decreasing new diagnoses. Advances in testing and treatment have led to a decline in new diagnoses among Black Americans in recent years. 2. Community-led initiatives. Organizations like the Black AIDS Institute and local grassroots efforts have played a pivotal role in raising awareness and providing resources. 3. Improved treatment outcomes. Increased access to ART has improved health outcomes for many Black individuals living with HIV. Conclusion. HIV/AIDS continues to disproportionately affect Black Americans, highlighting the urgent need for targeted interventions that address the social, economic, and cultural factors driving disparities. By expanding access to prevention tools, improving healthcare equity, and addressing stigma, it is possible to reduce the burden of HIV/AIDS in Black communities and move closer to ending the epidemic in the United States. Addressing this public health crisis requires collaboration, sustained investment, and a commitment to health equity.